So on to the questions and answers. So remember, we're audio recording the session. We're going to post the Q&A, so just keep that in mind when you're asking your question. And just a reminder what Rob said before, please no policy questions. Those should be directed to the ministry, but we're here to answer any questions about RISE, any questions about how you can support teams in your community or a variety of teams in different regions. So I'll open it up for questions. Carrie? Carrie's just helping us with the folks who are in the online platform, so questions from WebEx.
Great. So I have two questions from WebEx. One of them is more general, and another one is fairly specific. The first question is, could you explain how you envision us linking to teams that could use our support?
Yep. So the ministry has made available a listing of all of the teams that have been invited to full application and the listing of teams in development. And then I also mentioned those innovative models. Those are also listed. They all have a point of contact. As I mentioned to you before, keep in mind that the teams invited to full application are very focused right now on their application. So if you were to write to any of that list of 31, I'd strongly encourage you to be very focused in what it is that you're proposing to offer, because they have very limited bandwidth to accommodate other things. But if you were to say, hey, I've been reading up on OHTs, I know a lot about digital health, I see you need to deliver on this particular issue, here is how we can help. But keep in mind that we're trying to point free resources to these teams. I mentioned before the importance of equity, so we recognize that this is a great business opportunity for many companies, but we're also very, very committed to try to get as many free resources made available to teams as possible. So you can write to these people, but I would encourage you to think about, if it's the 31, they have very limited bandwidth right now, and they would need to know very precisely how are you going to help them with something that will help them write a better application. And was there a more specific question?
Yes. So the second question is, what are you hearing or learning from teams regarding the supports that they need around developing a model of governance?
Yeah, well, a lot of it feeds back into the collaborative governance piece. So we've had a lot of conversations with folks. I showed you a slide about leadership infrastructure. So everybody needs some way of setting up that leadership infrastructure. I'll just go back to the slide so it's in front of you while I'm speaking. But what we're hearing more and more from people is they're grappling with the collaborative governance piece. I've been to a few talks about this, and I was very persuaded by a talk where the message was, don't worry about the end state. It doesn't matter what you will end up doing 3 years from now. You could have, an executive committee from every board that sits on another central board that oversees the team. Don't worry about that. For now, what you need to be focused on, are those 3 steps, but the most important piece is the trusted relationship. So how do you create an environment in which these very disparate groups, organizations with very different histories, often with sometimes fraught histories in relation to one another, how can they start to build the trust that will allow them to move to whatever is the right collaborative governance model for them in the future? The ministry has clearly signaled they respect the independent voluntary governance that has such a rich history in Ontario. Those organizations will continue to have their own boards, but they need to figure out how do they build the relationships that allow them to make decisions collectively. And in some point in the future, they'll settle on a governance model, but in the short run, they just need some agreement about these 5 points, some way to make sure they're bringing their own boards and organizations along on that journey, and they're building the trusted relationships. So that's what we're hearing from the teams, and that's what the RISE brief tries to address. As we gain more intelligence from teams about how they're putting it in place practically, we'll add that to the RISE brief. Because right now this is what we're hearing the need is. Here's what, from a variety of sources, we've heard might be ways to think about approaching it. But in future, we want to actually profile examples of excellence on all these different topics in the RISE briefs. And I think we have a lot of room to add really compelling examples about collaborative governance to the brief. Other questions or comments? Let's focus on in the room. Any questions or comments from folks in the room? Yes, yep. Yeah, can you just turn your mic on before you speak?
Hi, so my name is Mike. I'm with Beacon. We're a digital mental health provider.
Yep.
So we're actually a group that's in discovery. So I was
Uh-huh.
wondering if groups that are in discovery will be made public knowledge as well going forward so that OHTs can reach out to us directly as well versus us only reaching out to them.
Absolutely. So, I mean, as of right now, the decision was to make available the 3 listings. I'm not aware of a decision to do anything differently. So what I'd encourage you to do is to send a question into the ministry and provide your reasons for why you think that might be helpful, and then they would take that under advisement and then decide whether that makes sense. For the time being, in the interest of transparency, I think it's fantastic that we've got the 3 lists and we know who they are. But it could well be in future that that changes. But I'd encourage you, if you think it's important, to bring it to the ministry's attention. Other questions or comments from folks in the room? I can't emphasize enough that I've been back in Ontario for 22 years. This is such an opportunity for folks that live and breathe health systems to make a difference. It's just such an exciting opportunity. So, as I said before, what we see our role is helping to equip you with an understanding of where the needs might be, what the timelines are, what's already out there, so you can understand how you can fit in and add value to this incredibly exciting transformation.
Yeah, for many of the researchers in the room, this is a real opportunity to do knowledge translation. We have on-the-ground needs right now for research that you've done over years. And this has an opportunity to actually put some of that research, if it meets the needs and is framed in this context, actually into action for teams that are really needing it now. I couldn't stress more clearly enough that this is a real opportunity, but not just for researchers, but everybody that has experience or expertise in these areas. One of the things that we're trying to do is actually provide a bit of a brokering service to make sure that your expertise in this room is actually distributed to teams that are struggling with those concepts and those issues at the moment. And so part of the RISE network is for teams to actually send questions in and problems in. And then if you're signed up to the RISE network, we can actually deliver those in a matching service off to the appropriate people. It requires you to have some receptivity and to act quickly because teams are actually moving pretty rapidly. So it takes that level of work, but if for knowledge translation, that actually is required.
Absolutely. Sorry, I'm struggling to find the slide that lists all the types of expertise. I'm sure I went through it somewhere, but anyway, just echoing Rob's comments, but also that, we have a broad conception of expertise that includes folks with lived experience, practical operational experience. The associations provide tremendous value in this space, and the RISE website is a way to try and channel that. So if you know of events coming up related to OHTs, we're profiling ones from the OMA, the OCFP, any organization out there that is trying to present information in a way that helps teams get farther faster. Carrie, other questions from folks on WebEx?
Yes, one question and a plug. If you are interested in getting involved in the RISE network, we'd encourage you there's a survey on our website that would allow us to understand a little bit more about your area of expertise and to undertake some of that matching work that Rob was just speaking about. So I'd encourage you to go and sign up for that. In terms of another question, one member online is wondering, what are ways that we can contribute to avoid having the hospital agenda dominate these conversations?
Yeah, well, I think my sense is just speak up. I mean, any table I have been around with teams, there's a real recognition that there's a history in some communities of dominance of hospitals, sometimes at the perceived expense of other players. And there's a recognition that if teams are going to be successful, they have to be able to work across sectors. And you've heard me emphasize the incredible importance of primary care, but it's also key to have home and community care in the broadest sense of that. There are many mental health and substance use providers out there, service providers out there that are absolutely essential. There are housing providers that are essential. Many of our challenges with alternative levels of care beds could actually be addressed in part through housing solutions and supportive housing. And I think what Ontario Health Teams are about are creating a platform where every partner can play to its strength, but we have to remember it's to achieve a goal, and that goal is better care experiences, better health outcomes, but we have to keep costs manageable, and we have to bring providers along with us and make sure that they feel like we're attentive to their concerns as well. And that's a very, very clear goal. So I don't know what more RISE can do, but we want to make sure that the expertise that's brought to the table isn't simply coming from acute care. We think there's incredible depth of experience in home and community care and primary care in a variety of different sectors, and we're trying to channel all of that. And we've worked very hard in the briefs to try to reflect that diversity. So we point to many, many players in the system who can really add value in a particular domain. Collaborative governance is an area where the OHA, for example, has done fantastic work for years. And now there are other groups coming in who can complement what they bring to the table with some other insights. And so we're trying to make all of that visible to people.
Yeah, working at a hospital, just talk a little bit about kind of what the hospital's role is. I think the framing around OHTs is changing and is obliging hospitals to change their thinking to some degree, to be much more population focused, and with the expectation that funding, per capita funding, will be coming to OHTs that has to be managed by that OHT in the long run. We actually have to think about how to convert, how to deliver care in different ways. Most hospitals right now are at overcapacity in Ontario, and part of the solution for that overcapacity problem and hallway medicine is by strengthening the community sector. So that is one of the rationales for OHTs. So hospitals actually do want partners in the community sector to try to shift the care so that less expensive care is needed for patients that don't need it, and really focusing on attention that those that do. But it is very cultural changes in this province around how health providers have to think about delivering care to populations and how they have to actually develop trusting mechanisms to be able to enable shifts in care over time to different groups.
Other questions in the room? Yes.
So just a comment about the collaborative governance piece. I think people are seeing a lot of, like you're saying, the OHA, other groups like CHO, even the OMA are proposing different types of leadership or governance structures that the teams can bring forward to converse about. And really, they might be different iterations, but they're all the same. It's all about multiple players coming to make mostly consensus-based decisions. So I think it's getting people, whether you're from acute care, whether you're from community, whether you're from primary care, is that it's not a huge cultural difference at the fundamental level where it's just coming together, and whether, if you're focusing on budgets or things like that, it's not going to work. You need to think about if we're really truly person-centered, where are people spending the majority of their time? Yep. Whether you're a small agency, you might be providing the bulk of the care for that person.
Absolutely.
So you need to think about it in that way. So I think when people focus on differences, and really a lot of it is quite the same going forward.
Super.
I think in this type of community, we have to learn from the experiences across the world around this, and there have been tremendous successful experiments like this in many countries, New Zealand, Australia, in Europe, and in the United States with some of the accountable health communities and accountable care organizations, and learning some of the recipes around what's taken. One of the key recipes, and we're featuring it, and the ministry features it in the guidance document, is actually the engagement of patients and families around what their care should look like. We are failing Ontarians in this province around connecting care and bringing their needs and expectations more clearly to the table in the redesign activities is absolutely essential. And this is where expertise in this group could actually really help, is actually how do we do that? How do we make sure that patients' needs and preferences are front and center in the delivery of this? That can actually be, that's an important role for the supportive mechanisms for the RISE.
Carrie, any other questions online before we wrap up? No? final call for questions for folks in the room. All right. So let me just end by thanking everybody for joining us. We hope this is the first of many in-person encounters. There's lots of online stuff that's going to be happening in the weeks and months ahead. Again, a tremendously exciting time. We'd be thrilled if you're interested in joining the RISE Community of Practice. Just go to the website, click on RISE Exchange. As Carrie mentioned, there's a brief survey that we hope you'll fill out. It just helps us understand how you fit into the building blocks, also how you fit into the rapid learning health system, and whether you have particular expertise with certain types of conditions, other things, just so we can start to do that matchmaking when it's appropriate. So we'd be delighted to see you join that and start to contribute in the online platform. So thanks for joining us today. The slides, which I failed to mention, are already sitting up on the website, so you can get them at any time. And there's webinars coming up, as I mentioned, starting on the 26th of August. So thanks for joining us today. Bye-bye.